Everyone, and welcome to today's tutorial where we are going to go over how to answer the phone at a private practice rehab clinic. My name is Dr. Alex Earl. I'm the owner and co-founder of an educational entity and also in private practice. I run a private rehab clinic in Carroll Stream, Illinois, and these are just the tips, tools, and just strategies that we've used over the last 7+ years with our front desk and our admin staff to make sure that we're getting the most out of the interaction that we have with new patients as they enter our world. We want to make sure that as they enter our world that the expectations have been set up front before they ever step foot into our office. And so that starts with the first commitment that a new patient takes, which is picking up the phone and ultimately calling to learn more about us, or if they have learned a lot about us, then they are going to want to book an appointment. So it's important that we know that we are both good fits for one another, and that's really the point of today's call is, the point of today's tutorial about the first call is that we want to educate other private practice owners so that their staff can answer the phone, or if you are answering the phone yourself, you can instill value to new patients before they ever make it into your office. And here's why. Because most offices use the front desk role to simply answer all inbound calls and then to schedule new patients, which is pretty interesting because in this day and age, there's a convenience factor of allowing patients to schedule online. And while many offices prefer to use online scheduling for patients' convenience, the value of the outcome gets lost. And here's why. Because most people sell chiropractic care or physical therapy. We aren't. We're not advising and we're not selling chiropractic care. We are selling an outcome. We're selling a life free of debilitating back pain. We're selling the feeling of stepping foot on the field again to play soccer after a knee injury, possibly months away from stepping on the field. But we're selling that feeling you get when you step back onto the field. We're selling the feeling of competing again in events such as the CrossFit Open, when you were told maybe that your competition days were over or beyond you. So here's the main point is when someone calls, we're not just answering inbound calls to quickly get off the phone. We've all had those interactions where we've contacted medical offices, barbershops, just other areas of service, other businesses, other service-based businesses, and felt like it was an inconvenience to the office that we called. I remember calling a dentist, for example, to book an appointment for one of our children. And we were a new family, a new patient. Our son would have been a new patient to this dental practice. And yet it was an inconvenience on their part that I called. And to me, that just felt backwards. It felt like I had to really work hard to get our son on their schedule. And that shouldn't be the case here in 2022. And so some of this was the front desk representative or the admin simply had too much on her plate. And the thing that was probably the most valuable would be a new patient coming into their business. Ultimately, it's several $1,000, and multiple kids, so few $1,000s a year if we were to commit to going to this dental practice, right? That possibly could have been lost. So if the business owner was actually listening to how this admin or front desk representative was communicating to me on the phone, they probably would have lost their marbles because they realized we don't need really to worry about the trash or shuffling paper or some the many trivial things that take place at the front desk. What really is important is when the phone rings, you instill value in the practice. And that I think has gotten lost over the last few years and decades within the mainstream medical model. And so here's what we use our office for. Our front desk role is specifically, it's a strategic role that we use to instill value prior to coming in. And this also functions, the second part is to screen new leads to see if they're a proper fit into our clinical expertise. And what I mean by that is we are not a high volume chiropractic office. So if someone calls in looking for an appointment immediately, they've thrown their back out, they've slept funny, we typically need the front desk to have a little bit of a buffer, because in our experience, which is a obviously it's a biased sentence, that in our experience, but what we've noticed is the quicker someone enters into our world in an urgent and important, time frame, the quicker they leave, versus the longer it takes to have that initial conversation, the longer the patients stay and the more they pay and the more they're likely to refer. So simply by putting up a couple of barriers, we are able to see if this person is a really good fit into our business. And trust me, you don't want to just take everyone that comes into your business. Having some barriers is really important, not least of which is the effect that some very negative, pessimistic individuals, they drain the passion and the energy out of your staff. So if you're just accepting everyone, imagine the toll it might take on your staff, which is why we're seeing a massive exodus out of offices. I was just reading a McKinsey report that showed that um, I think it was 2 out of 10 people in the last 18 months have left their job, and significant amounts of them have left the industry that they went to school for completely. So 2 out of 5, that's near, I think it was nearly 40% is what their reporting was showing, that people are leaving their careers. And I think some of this has to do with this drainage that they're feeling. It's very draining to communicate and to serve other individuals. And so, what if we could put up a couple of boundaries to try to mitigate the effect that that might have on our staff? Perhaps our staff might be able to stick around longer because we're getting high quality people coming into our offices under the right conditions and under the right or with the right expectations. So, with the caveat is that we're not turning people away just because we can't help them. We do, we're not abandoning anyone. We're making sure that if we do not let someone into our office, we're still making the appropriate referral to, up to 3 other offices nearby. That's a topic of conversation for another time. But as it pertains to this, what happens on the phone, in our opinion, right, is that it is more important than the initial consultation, right? Because a lot of people think about it from the patient's perspective. As soon as they pick up the call and then they're driving over, they're already thinking about what they're going to say to the doctor. They're running through their clinical presentation about all of the things that they think the doctor is going to want to know, but they don't necessarily have that same setup in their mind or their mindset about how to communicate with the office. So they switch into this default mode of the brain where they just ask what they think are basic questions that, in my opinion, again, I think that our society has been conditioned to ask anything anytime they're trying to book a medical oriented appointment, which would be, when's the next appointment? Do you take my insurance? That sort of thing. And so what if we changed up the order in which the conversation took place and still presented a lot of value to them on the phone? And this is why I think the first commitment that they make is they pick up the phone to call you. And so it's one of the most important jobs is to field that first call with some humility, also with some very key components of strategic expectation setting, and we're going to get into that in a little bit here. But and here's why it really it saves time for the incoming new leads and your providers, because we want to make sure that the patients that belong in your office are, and that the providers that you have working, again, it could be you, making sure that you're actually dealing with people that you can help. For example, I'm not a very effective concussion or head trauma clinician. I know it. I know just enough to be dangerous. However, there's a clinic nearby that specializes in head trauma at chiropractic neurology. And so we refer all of our athletes, especially some really, really bad hockey and football and soccer headaches that have come from head trauma and concussion. We refer all of the concussion patients over to them. They're top-notch, character-trained chiropractic neurologists that, what the equipment that they have over there and the strategies that they use, they would blow us out of the water. So it makes no sense for us to take on a lot of, if any, of the concussion patients that want to come in and get treated for concussion. We just know we're not a good fit. And so it saves time and effort so that we know the patients that are in our office are there for mechanical low back pain, mechanical neck and shoulder pain, and respond really well to manual therapy and hands-on care. That's what we know, and that's what we would like to consider ourselves, very effective at. Um, and so moving on here, it establishes value in the business before they ever arrive for their first appointment. And again, I'm a firm believer that the first call that they make with your front desk representative sets the patient up for success in the treatment room. And it also, as I mentioned in the bullet point up there, it sets the tone, sets the clinician up for success because they're already addressing some of the common concerns that people have. And here are some of the main medical stressors. Insurance, they're going to want to know, do we take their insurance? If we don't, why not? I think patients are conditioned, well, maybe up to about 2016 or 17, that patients were very used to using their insurance, and it would be quite odd to have clinicians not be in network with their insurance. But with the emergence of Obamacare and these massive high deductible plans, in essence, some patients might have a $10,000 individual deductible, in which case, we're not reaching $10,000 for chiropractic or physical therapy. So in that sense, you don't have insurance. It's as if you're self-pay. So having the right tools or the right conversation, strategies will help offset the stressors that they have before they ever come in. They're going to want to use their insurance. How can we communicate to them in a way that exudes confidence, but also it instills certainty into their decision? And that's the last point there. A lot of times there's uncertainty in their voice, and there's also uncertainty in what they already view or feel about chiropractic and physical therapy. Some people don't even think that chiropractic care is for them. They're just calling to book an appointment because maybe their medical doctor referred to our office, or a close friend whom they trust said that you have to go see, Dr. Smith because they're the only ones that understand what I went through, and then they'll do the same thing for you. So again, one of the main points for this tutorial is understanding the pathway from which someone comes into your world, and then communicating to them according to that pathway. And we'll break down the pathways in a minute here. But all of this stems from Human Behavior 101. What you let them believe you're going to do is more important than what you actually do. I was just reading a study that was showing how very little of the treatment outcomes can be attributed to the treatment. And conversely, it's kind of like, don't let the highs get too high and don't let the lows get too low. And that's because sometimes we base our own value as clinicians in the outcomes we achieve, and we attribute those to the techniques and the treatments that we render. And so one of the caveats to this is we then, that's a double-edged sword, which means when we're not getting the outcome we want with a patient, then we quickly start to doubt, are we good enough? Was it an effective adjustment? Did I do the right soft tissue? Was dry needling was it appropriate? We begin to have doubts because they're not getting the outcome that their original goals and desires were. And so I sometimes have this conversation with staff and patients by saying, we will do everything that we can while you're here, but ultimately we can't go home with you. So if we have a wonderful 45-minute session, we're getting pain reduced, we're increasing range of motion, flexibility is noticeably different, strength has improved in the course of the 45 minutes, and coordination, balance, all of these wonderful objective markers for human performance, we can see that they're making a change. However, if they go home and they smoke a pack of cigarettes and they drink a 2 liter of Coke while they're eating McDonald's every day for dinner, which I know is very very an extreme example, but my point is this: all of the treatment that we just did for 45 minutes is good and it is quality work. We just don't have the ability to facilitate change of their environment, which might be just pouring gasoline on this clinical fire, figuratively speaking, this clinical fire. So what we do versus what they perceive we're doing could be two totally different things. So here's an example, kind of coming back to the initial call here. Um, Here's an example. If their first question is, I'm sorry, if your first question is, what insurance do you have? You are placing the value of the office on insurance, and that is an exact question that I got from the dental practice. I said, I called up and said, I'd like to see, Dr. Smith or Dr. So and so. Our son Corbin, he's got a little bit of a tooth situation going on. I'd like to make an appointment. And when's your next pediatric new patient evaluation? And they'd said nothing. There was no, oh, I'm sorry to hear what's going on. We see kids all the time. Are you new to the area? There was none of the relationship building, human interaction. It strictly went to, what insurance do you have? And even the tone, I could just feel the tone of this woman through the phone, and that really irritated me. So, we call. Well, I put the phone down. I literally said, "Okay, you have a nice day, ma'am. I'll try another office." And I hung up the phone. Now, part of it is because I'm stubborn, and I know that would never fly in my own business. And so that really that kind of irritated me, that they were placing the value on me and my family based on what insurance we have, which I would actually posit as a very ethical dilemma. If we're only providing a valuable insurance to your place of business, then I think you're not valuing the reason you got into business or into practice in the beginning, which is to help people. So if you're only placing value on insurance, then you're not actually placing a value on helping people, which I take exception to. So here's the key point: do not let anyone arrive at your office not knowing anything about you. That's something that I learned from one of my mentors. Here's how we identify what they know about us. We ask value-based questions. So in the beginning, what I just mentioned, what insurance do you have? That's an example of a resource-based question, because they want to know, what resources do I bring to the table? Whereas I want to discuss value-based questions. So here's what we need to know. Here's an example. Well, I guess lesson one: identify what they know, because it's really important that before we can utilize any of our scripts and specific value-based questions based on what they know about us, we need to know, well, what they know about us. We need to ask. So here's actually the first script that I'll give you that we use in our office. Someone will call up, we'll answer it, we'll say, "Thank you for calling Active Health and Restoration. This is Caroline speaking. What seems to be the issue today?" Now, notice it kind of jumps right into their story and what seems to be going on. Immediately, they might be taken aback by that, which is okay. So that's where someone might say, well, I've just got I've been dealing with some low back pain and I'd like to book an appointment. And so here's kind of where this goes, right? If they say something like I just said, which is, hi, I've got a little bit of a back situation here. I'd like to book an appointment as soon as possible. That is telling us one bit of information. And yes, this is a tutorial, but there is a higher amount of social intelligence that has to be involved when you're speaking to another person on the phone. I'm outlining 3 pathways for you, and sometimes it's not that clear. You almost have to dig a little bit to figure out which pathway this person is coming from. And here's the first insight that will tip you off to which pathway, all right? And so the first key insight is, if I had said, what seems to be the issue today, think about it again from your perspective. If you were referred to the office by a medical doctor or a close friend, you would have said something very different than, hi, I'd like to book an appointment as soon as possible. So the potential patient in the above sentence places the emphasis on time, like it's important for them to get seen right away. which means that they might not know much about you other than they're viewing you as the exact same as every other chiropractor or therapist nearby. You just call up the one, take the one that has the quickest opening. Think about an oil change, which is a commodity in the service-based business. One place charges $19.99, another charges $34.99, and another one I've seen charges $65. Now the one that does 65 does way more, and they have a ton more openings, and they can see you quicker. And so that's their business model, is to see you quicker, but to charge you more. So they're placing an emphasis on time. Whereas if someone is getting referred by the medical doctor or by their close friend or family, what they're valuing is the outcome that their friend has achieved, or that the medical doctor has, for lack of a better word, promised or vouched for on your behalf. So they're not going to be bothered by time. They're not going to say anything about booking an appointment as soon as possible. They would say something like this: "Hi, I've been dealing with some really painful low back pain when I was at the gym yesterday. And my personal trainer, let's just call him Tim, Tim said to come see you guys. He said you worked on his back and he thought he was never going to be able to lift heavy again. But thanks to you guys, he's back. And so he said to give you guys a call. And he's never let me down before. So I thought I'd give you a call to see what you could do." See how that's a very different intro. So this guy has already achieved an outcome, and he's passing that on to his client, and then his client ultimately calls our office. So I thought I would just highlight that and say these already are two very different entry points, just based on what they don't say. In the above example, they don't mention a referral, they don't mention a close friend saying that they came to our office, they jump right into time. So if you want to play a different game, you have to pick up on the small little nuances that patients provide on this early in the early stages of the phone call. So here's a way that you can respond as a front desk. Feel free to take this, use it as you deem fit. It's really effective. So here's what our front desk would say: "I can certainly help you do that. Before I plug you into our schedule, would it be all right with you if I asked you a few questions about what seems to be going on?" So again, we're gonna get them on the schedule. If time is their main concern and they want to be seen as soon as possible, then one of the best ways to break down a barrier of time is to ask permission to ask them more questions. It's called permission-based selling or permission-based marketing. Another way of saying it is like, is it right if I outline with you the best ways that patients enter our world? Or you could say, like, if I may, if it's right with you, is it okay with you? Things of that nature go a long way, because if they say yes, then they're not really pressed for time. They might say they only have a few minutes, they're at work and that sort of thing. However, that being said, when I've used the permission-based questioning, those patients, even though they presented themselves with a limited amount of time to even talk to me on the phone and they just want the quickest appointment, I have actually had the longest conversations with them. And it reminds me of, like, an email thread that I once was given an email that said, "Sorry I didn't respond to you sooner. I just didn't have time." It's like, wait a minute. All you had to say was, you didn't have to respond, but you didn't have to then write a response about not having enough time. That probably took just as much effort, if not more, to let me know that you didn't have time. And again, this is the human behavior 101 that I'm talking about. And so when someone says they don't have a lot of time, I have ended up having 30 to 35-minute conversations with them, which they said they didn't have. And it's just because of the free flowing, conversation that we can have. So, the other question that you for sure will get is, do you take insurance? And again, this is kind of an issue or a topic of conversation that has ebbed and flowed over the last couple of years. Again, because of some of the higher deductible plans, people understand even if they have insurance and you take it, there's still going to be an out-of-pocket expense. But I do like reframing their questions. I don't like to always respond with a question after being asked a question. I think that that can be perceived as quite petty sometimes, and awfully evasive. If someone asks you a question, you can confidently give your opinion. You can give an answer. So I don't want you to think that every time someone asks a question that I'm advising that you respond with a question yourself. I don't necessarily like doing that. As I mentioned, I think it's quite evasive. But if someone says, "Do you take insurance?" Um, I want to use this to reframe the conversation away from the thing that they value, which is insurance, and switch it over to the thing that we are going to give them permission to value, which is the outcome. So we want them to achieve a full fall season of soccer pain-free, or getting back into the CrossFit Open like I mentioned ago, or picking up their child for the first time in 2 years because wrist pain was preventing her from picking up her daughter. That one is all three of those are real live, real life patient testimonies. And so if you notice, I didn't talk to them about insurance, and I didn't talk to them about chiropractic or physical therapy. I didn't. I talked to them about the thing that they were missing out on. So by switching the conversation away from insurance over to the thing that they're missing out on, now we're getting somewhere. So this is what we would refer to as value-based questions. So here's a question that we respond with regularly, which is, and it's almost in how you deliver it as well. It's not just saying the words, it's the confidence that you exude through the phone that it is normal for you to not use your insurance. But before we discuss that with you, I want you to know that it's okay to not use your insurance. And how I do that is by asking this question: is using your insurance the only reason you are looking to book an appointment with us today? And I'll repeat that. Is using your insurance the only reason? And notice my inflectuation when I say the only. It's very different than if I read it robotically. Is using your insurance the only reason you are looking to book an appointment with us today? I want it to stick. I want it to sting a little bit. I want them to pause, because the answer is going to be no eventually. But I don't want to come out and just say, no, we don't take insurance, because we do. We take one insurance. But I want them to think long and hard about, am I valuing insurance, or am I valuing the outcome that going to this office will get me? So I'll say it one last time. Is using your insurance the only reason you are looking to book an appointment? Now, this does happen regularly when patients call up our office through the insurance provider portal. So we are only in network with one insurance group, and patients regularly find us on this group's website, pick up the phone. There's a phone icon. They click that and it calls our office. So they value that we are in network with their insurance because they found us on their insurance's website. So that's a very different conversation, but I still ask this insurance question to them because I want them to know that yes, we do take their insurance. You're right. You called us from, your group's website. But I want to know, are you only interested in coming to see us for that very reason? If so, there's a good chance we might not take you on. And I don't threaten them. And again, like I said earlier, I don't abandon them. But I want to just make sure that if someone comes to us from their group's website, I still want to switch the mindset on their part. So when they show up, they're there for an outcome. They're not there to for the convenience of their insurance. So if they say yes, then say, I'd be glad to answer your question about insurance. But before I do, I'd like to take a moment and ask you a few questions about what seems to be going on. Can you tell me more about what's going on? If they say no, I say, great, tell me more about what seems to be going on. So we still get the conversation away from insurance, and I get a little bit more clarity as to what I'm going to have to say later on in the conversation. But we still begin the conversation with what seems to be going on so that I can start to wrap my head around, not just clinically, but again, is this a possible referral that needs to take place? So again, making sure that they're a good fit is really an important step. And as I mentioned with the concussion patients, we don't take everyone. So by asking that question up front, we can save a lot of time and energy rather than not asking those questions up front. Then they come in, they're sitting in your office, and you realize, oh my goodness, like this person has a really bad concussion. They should not be in our office right now. They need to go to the specialist. So anyways, next up, again, on the do you take my insurance? You could say, now I want to circle back on your question from a few minutes ago. Now that we've established that you have an issue that responds really well to our care here or what we offer here, we know you are a good fit for our office, and we are a good fit for what you are looking for. And here you go. This is the money ball thing, or this is the money maker right here. When you come in for your first visit, we will need your driver's license, and that's it. We won't be needing your insurance card unless you have, and then what I say is, unless you have, Blue Cross Blue Shield, PPO, we have a dedicated insurance liaison whose sole job is to get you all the necessary paperwork to work with your insurance provider if you do not have Blue Cross Blue Shield. And here's why we do that. We set the expectation up front before they ask, "Do you take my insurance?" Or before when they say, "Do you take my insurance?" We are having a conversation about changing or reframing the expectation to use your insurance to achieve the outcome that you want. Then when I bring it back into the conversation, I let them know you don't need to bring your insurance card, which is a softer way of saying, no, we don't take your insurance. But you can bring your insurance card if you have, and then again, insert the one or the two or the three that you do take. I picked that up from a pelvic floor practice that is out of network with everyone. And that's just something that they've found to work really well. And again, it's also in the delivery. I'm big on the delivery component because you could frustrate someone if you just say, no, I don't take your insurance. But then we're not able to help them. And if we can't help them, then why are we in private practice, or why are we in the medical field to begin with? I thought we were opening up these businesses to help people. And if you're just turning people away because you don't take their insurance, well, then there's got to be another strategy or tactic that we can implement in order to fulfill our business goals, and also fulfill our clinical career. Like that's got to be a big picture take home point here is get out of healthcare if you don't want to help people. Or if it's an inconvenience to you to actually help people, like then there are other jobs for you to do. For me, I really enjoy the relationships that I've formed with patients and clients and staff, and I find it extremely fulfilling to walk alongside someone and nurture them, and then watch them literally cross the chasm from chronic pain or from debilitating pain into a thriving, active, healthy lifestyle. To me, that's the sweet spot for me. But anyways, back to this. These are the three expectations that we try to outline on the first call right away. These are strategic in nature, and what I mean by that is we are very direct when it comes to what's called takeaway selling. Which is like, hey, a very strategic sentence is, we don't take everyone, or this program is not for everyone. I'm sure you guys have seen that a bunch of different places. This X, Y, or Z product is not for everyone. It's only for people with, and then A, B, and C. So this is what we say in our office. We say we don't take every inquiry on as a new patient. And that's because we're just not a good fit for a lot of people who are looking for, potentially the traditional chiropractic appointments, which, typically run 3 to 5 minutes. You are in and you're out. You get adjustments only, and you have typically very long treatment plans. You might have even gone into to the office on, a very low initial exam fee. You got your x-rays done, you got your first adjustment for probably less than $50, and then you have a never-ending treatment plans. So we don't do that. So that's if you're looking for that, well, then our office is not for you. There's 3 other offices that have that practice type within a mile of our office. I'll be glad to get you their contact information if that's what you're looking for. I can send them to you right now. So immediately we're distancing ourselves from the style of practice that we don't operate as. But if the patient is, or the potential patient is looking for that style of practice, we will give them the information because we don't actually want to take them on. They're looking for something that we don't offer. The next one is we want to identify a common frustration. And this comes not from within the chiropractic or physical therapy world, but from the traditional model of healthcare. So we might say something like this. One of the things that our office is different is that we recognize that the traditional model of healthcare is really frustrating for consumers. You go to the doctor's office and rarely know how much the appointment will cost, if insurance will cover any of the appointment, and then you get stiffed with a massive bill in the mail in a month. So we decided a long time ago that we aren't going to do that. We're going to be upfront and transparent about our $295 patient exam fee and lay out our treatment plans for every patient of ours. And we'll let every patient know what we think is wrong, how long it will take, and what the cost will be for every single new patient we take on. How does that sound, Mrs. Smith? Now, again, it's strategic because inside of outlining a common frustration within the medical field, I also put our new patient exam fee. I just put it right in there. And I was like, all right, it's $295. Come in, we'll tell you exactly what we think is wrong. We'll map out a specific plan for you with a realistic time frame on when we think you can recover from it. And the third thing is we will let you know exactly how much you will pay. Or again, if you happen to have the one insurance policy that we're in network with, you'll see what the insurance component. That's why insurance is mentioned a minute ago about the frustration. If you are in network with a lot of providers, a lot of insurance networks, feel free to use that line. But it is something that we want our patients to know that is one of the goals of the new patient exam, is to let them know what we think is wrong, how long we think it'll take, and how much it will cost. If you can do that, your price will invariably be irrelevant if you're cash or if you're in network. They're not going to say yes based on your insurance status. They're going to say yes because you're fulfilling on their deeper internal driver, which is, again, finding out what's wrong, finding out how long it'll take for them to be well, and finding out how much. The how much might be beneficial if they have a spouse involved, so that they can realistically have that tougher conversation with their spouse, because the spouse, typically one of the biggest objections on price is lack of spousal support. So I'll do another call or another training video about overcoming spousal price objections. But for now, just getting those three things down: what's wrong, how long it will take, and the price or the cost. And the cost also, the last thing I'll say, the cost also includes energy. If we agree that you should come in twice a week, then you might have to rearrange, your work schedule. You might have to rearrange your workout schedule. You might have to rearrange your family schedule a little bit if you only have after school available. So there's things like that. The energy, there is a cost of energy. Okay, so here's the third selling proposition here. Set the expectations for the first visit. Now, this is where the front desk comes in and sets the clinician up for success in a way that no online scheduler ever does. Yes, there's a convenience factor. I will acknowledge there's a convenience factor, but the convenience factor in this day and age, it's a one-way street. And what I mean by that is, as quickly as someone goes to your website to book an appointment, that's as quickly as they can go and cancel it, and that's as quickly as they can drop off. They can book it. You can threaten them with a penalty or a cancellation fee less than 24 hours. In our practice, we've not collected a single cancellation fee in 7 years. I think it's $50, and we've had to collect on zero cancellation fees because we are constantly communicating with our people, and we don't allow online booking. If you truly asked a clinic that accepts online scheduling, they probably have a significant portion of drop-offs off their schedule because it's convenient for patients to go on book, and it's equally convenient to go on and cancel the appointment without any conversation with you at all. And I don't know about you. I'm not a controlling person, but I like understanding where our patients are at from a human standpoint rather than just being very transactional. We're not in the transactional business. We are in the transformational business. So Set the expectations up for the first visit. So this is how we do that. We say um, something to the effect of something like this. Now, at your new patient visit, it's really important that you wear athletic clothes, as we will evaluate every bone, joint, tendon, ligament, and muscle in your entire body over the course of the 45 to 60-minute visit. There is no need for you to bring any x-rays or MRI scans that are older than 1 year. And if at the end of the evaluation, we believe that you need additional lab work, such as blood tests or any additional imaging, like maybe an x-ray or an MRI, our chiropractic physician will make that decision and let you know. If the evaluation indicates it's appropriate to start treatment, we will do so by providing you with options of care, which will help you get back to, and then you could say, get back to the CrossFit games, get back to, help Johnny get back on the field. He wants to play soccer this fall, or helping Susie Smith pick up her 2-year-old daughter. So remember, insert the activity that they had mentioned earlier that they were missing out on. So I'll just repeat that last line again. If the evaluation indicates it's appropriate to start treatment, we will do so by providing you with options of care, which can help you get back to soccer this fall, which will help you get back on the field this fall, which will help you get back to the CrossFit games. Think of it like that. Like we're selling this person already before they come in. We're selling them on the outcome. We're not doing anything to them. This is not sleazy salesmanship. This is selling to serve, is a really good way of putting it. Our treatment is a service to them, so we're selling to serve and then fulfill on that treatment. So here's the initial call framework. Pathway number 1, which I refer to as the referral pathway, which is what they already know about you is what they value. Pathway number 2 is the uncertainty pathway. What they don't know about you is what they fear. And pathway number 3, the insurance pathway. What they value isn't what they really value. They are only conditioned. So here we go. Pathway number 1, the initial call framework here. What they already know about you is what they value. They value the results you've achieved with a trusted friend, family member, or professional authority, such as an MD referral. We do get a lot of medical doctors referring, especially orthopedic and primary care, physicians that refer to us for specific, our specific methods and outcomes. And so the trusted authority of the medical doctor is the value. And so notice insurance and price, all of that is irrelevant because they're coming based on the trusted word of a friend, a family member, or an authority. And they have a very different primary concern. Like I said, not money or insurance coverage, but an outcome. These are the people that will pay top dollar because they're searching for an outcome. Now, you can't exploit them. You can't just charge them more. It will just make it easier for them to become a set patient. And more on that in a second about what the objective is. Once they come in, we have specific objective for each of the pathways, which I'll share with you at the end. So here's some recommendations on what you should do when you're on the phone with them. Talk about the feeling they have, or they will have, they will have when they've achieved their desired outcome. Number 2, ask about any barriers to them achieving their desired outcomes. And number 3, ask about who supports them in this decision. Spouse financial concerns might be different than their own. And then this is another thing. Remind them over and over again of the successful outcome you achieved with their trusted health ally. So again, if they're starting to get a little bit, if uncertainty is creeping up in the phone call, you could just stop, you can pivot, and you could say, hey, Mrs. Smith, remind me again why, Dr. Johnson said that you should come see us. So now their response is going to be exactly the recommendation that they got from, in this case, Dr. Johnson. Dr. Johnson said nice things about us, which is why you're calling us. And now she's going to actually lobby to us on why she should come see us. You see how it's very different than just taking them on and saying, oh yeah, we get a lot of patients from Dr. Johnson. Our next new patient appointment is Thursday at 2 o'clock. Like that to me is so transactional. We're not actually going to be making a change in this person's life or helping them to facilitate a change in their life without having these questions done up front. Again, transformation, not transaction. Don't rush to justify your prices. Don't offer to give an explanation as to why you're out of network. And don't complain about insurance coverage so you can, quote, treat how you want to treat and not be told by an insurance company what is medically necessary, and end quote. And don't posture your voice and tone as passive using fillers and uncertainties such as I guess or there's nothing more frustrating than when a medical doctor or a friend or um, a family member tells you to go see someone, you call them up, you're all excited to get this outcome that you're looking for, and then the person that you're talking to is like, I guess, yeah, I guess we could see you, you know, we yeah, you know what, sure, we'll take a look. To me, that is screaming, again, we're kind of an inconvenience, but it's also screaming that the person is the front desk admin is getting in the way of the wonderfully skilled clinician. And to me, that there's a big disconnect between what was told versus what was executed. And the execution of the phone call really needs to be spot on when you're taking on a referral. Second one, pathway number 2. What they don't know about you is what they fear. And this one's interesting. They are still in the information gathering phase and still not certain you can help them. Our goal is not to book a new patient evaluation. Our goal is to help them make the most appropriate choice they can. How do we help people make choices? Well, we ask questions, we use story, but in the end, our goal is to simply help provide information and give them potentially, and this is what I'm going to argue here, give them a taste of what they can get so they start realizing that there's nothing to be afraid of and that they can switch from a state of fear into a state of belief, that they believe that this is the right place for them. And this, I said this once to our front desk, that the goal for this type of patient when they come in, when they're afraid that maybe chiropractic care won't work for them, or maybe that they might get swindled, and then we charge them thousands of dollars without their consent, and then they're left paying a huge bill, or that what they have going on that won't respond to chiropractic care. Like there's all sorts of reasons why people have fear, and so what we want people to know after this phone call is that we understand them and that we understand that what they're going through is very real. If we can do that, then half of this person calling in and the fear that they have is already overcome. Then the other half of it is, can you just get them in so that they can get a glimpse or a little taste? That's why I like to use the word taste. Can they get a taste of what's to come? And so that's why we do offer what's called a discovery visit, where they come into our office and they can discover that we're a real place, that other people are getting well, and that they are not alone. Like this place, can help them. So they will default to the standard set of questions our culture has ingrained in us and how we speak to a doctor's office. They'll badger you. They'll kind of ask what they think are going to be the standard questions. Do you take my insurance? How much is an appointment? When can I come in? They'll be very direct in their speech, and so you'll have to pick up on that. When someone speaks that direct to you, they're either a very assertive personality type, in which case the best way to talk to an assertive person is with an assertive tone. So I'll tell you a brief story here. When I was talking to a very assertive person on the phone, and he was adamant about knowing how much it will cost to have his daughter come in. He's like, "Look, I'm in the finance world. I know what's going on. No need for the dog and pony show. Just tell me what your price is." And I kept, so here's what we'll do. Here's how long the appointment is. And he finally just said, "Look, how much is an appointment?" And my response to him was, "How much do you want to pay?" And there was a nice long pause. And he said, Well, the average chiropractor, is probably 50 to 75, but I would imagine you're pretty good. So you're probably over 100, maybe 125. And I said, double it. And I had on purpose, I had a little bit of an edge. I had a little bit of an assertive tone with him. And once I said double it, I was in because I was speaking the same way to him, and he loved it. He in the beginning he thought he could intimidate me, and I won't be intimidated. I will flank people, but I won't be intimidated on the phone. And so anyways, I share that with you because most of the time when people just want to know the facts, it's really coming from a place of fear. They're not sure in themselves to make a decision. So they're asking very quick, succinct questions. So if your front desk is only answering these questions, yes or no, do you take my insurance? Yes. Or you could just say, no, we're out of network. Then they're like, okay, well, how much is it? It's 75 for an appointment, 50 for follow-up. Okay, when's your next appointment? Well, we have Thursday at 2. Okay, great. I'll call back if I need you. And they hang up and they're probably calling another office. So it's not necessarily that that we have to do a better job at selling them. It's like or it's that patients won't book unless we take their insurance. And that's what you'll get. The pushback that you'll get from your staff is that patients won't book unless we take their insurance. When really, if you were to listen to the phone call, it had nothing to do with insurance. It had everything to do with what you allowed or what your staff member allowed the patient to say on the phone, and you didn't follow up with a different type of question or a different type of answer. Again, if someone's asking simple questions and you're giving simple answers in return, of course they don't value it. They're going to move on. So that's kind of my rant on this pathway here. So the most common objective to booking new patient evals is due to their skepticism, not ours, but theirs. So here's one of the best ways to go about pathway number 2. No, the do's: utilize social proofing by sharing a patient's story. So this is just a quick example I'll share with you. Just this week, we had a gentleman just like you, Mrs. Smith, come in suffering with sciatica. He was able to walk up and down stairs. I'm sorry, he was unable to walk up and down stairs. It was affecting his sleep, and he was not able to get on the ground and play with his grandkids. I'm sure you can relate to what he's going through. And you know what? He started right here on the phone with me. He booked a discovery. He came in. We had a wonderful time getting to know him. After that, he came in for an evaluation, and right now he's able to walk up and down the stairs. And after just a few appointments, he's getting on the ground and playing again with his grandkids. Remind me again, Mrs. Smith, how nice it would be to get on the ground and play with your grandkids, or to get up and down the stairs. That would be pretty nice, wouldn't it? And then the second thing I would say is, wouldn't it be nice to have this low back issue taken care of properly? And a strange thing happens when you use the word properly. It implies that all other options other than yours are done improperly. So I think we'd be fooling ourselves if we were to say that new patients are only calling us. And when I say new patients, I really mean new leads. People are scouring the internet. They're looking at Google reviews. They're putting out a bunch of feelers elsewhere. I'll do a whole nother tutorial on why our website is actually a 24/7 employee. But for right now, I think it's important to say in this state of the call is that um, they have probably hedged their bets. They've probably called 3 or 4 other clinics nearby to see who could take who could take them on, excuse me, the soonest, and also who is the cheapest. So if I come in and say, wouldn't it be nice to have this taken care of properly? Again, it implies that all the other people that they've been talking to are going to do a quick band-aid fix. And if you're like so many other people, Mrs. Smith, you're not interested in a quick fix. You're interested in, yes, getting this taken care of, but getting it taken care of properly. That's one of the magical words that we use regularly. Magical, that's kind of a very Disney way of saying it. But I think you get my point, is that is a little bit of a hack. Maybe that's probably a better word to use than magical. But here we are continuing on with pathway number 2. The reason that you ask this question is to see where they financially value a chiropractor or physical therapy appointment. going back to when I said to the guy, how much do you want to pay? If they say 35 to 50, then they have in their head that we are a comparable to a high volume adjustment only franchise clinic, and we're not. If they say, well, you're pretty good, 125, maybe 150, then that gives you a better insight into their current understanding of the cost. In which case I reply with, I can see you have an accurate ballpark range of chiropractic care here in DuPage County. We are not the cheapest office in our area. Is going to the cheapest office the most important thing for you when choosing a healthcare provider? If so, we have 3 other offices nearby that we are more than happy to send you over to for more information. We know they are looking for new patients. And again, I do have a little bit of an edge when I say these things. I'm not turning people away. I'm simply instilling value before they ever show up for the appointment. Don't over communicate unnecessary information. Remember, these individuals are filled with uncertainty. So the way that you speak to them are by over communicating unnecessary information, such as where you went to school, what certifications you have. Really, all they think is that, okay, this is too much for me to handle and process right now. So this is a giant red flag, or the alarm bells are going off in my head. Another one is don't be rushed for time. As I mentioned at the dentist, I felt incredibly rushed for time, and that it was as soon as I could get off the phone, that would have been convenient for the front desk or the receptionist at the dental practice. So we flip it. We're not rushed for time. And in fact, I've said this to someone on the phone and she didn't even realize it. I said, I've just spent the last 15 minutes with you on the phone, Mrs. Smith. Can you name me any other healthcare provider that you've called? I'll throw that in there, that you've called, who has ever done that for you? What other medical provider have you talked to on the phone for this long? And there'll be a long pause, because I can guarantee you no other medical provider has talked to these patients for 15, 30, 35 minutes. No one has. No one has. And if you're going to make, $2,500 on a case, or you'll make, anywhere, let's say $1,500 to $3,000, let's just give you a ballpark range, is spending 30 minutes rather than 5 minutes, is that worth your time? I would argue yes. And the best part about these is these 30 to 45-minute appointments are very life-giving. They're very fulfilling. You get to hear someone's story. You set that patient up for success in the treatment room. And these patients are so eager to get the treatment started that they are literally begging for the treatment plan options because they want to get going. And that's one thing that's very different about our office, is that we have an above 95% arrival rate for our appointments, and we have an above a 93% on our plan of care proposals, or conversions. I'm not afraid to use the word conversion. So when we do this right up front, we can tell in 2 or 3 months that all of our key performance indicators and our key improvement areas, our KIAs, our KPIs and our KIAs, all of those are going to look really good if we do this up front. So we don't want to be a pushy salesman, and we certainly don't want to coerce anyone onto our schedule for a new patient eval. We're not in the coercion business. Again, we're not going to be able to transform someone if they book an appointment based on fear, right? So we're not going to say there's no fear mongering tactics. There's no, that we're not putting down any other professional. We're not, we're certainly, we're not hyping up ourselves. Not at all. We are trying to take them from a state of uncertainty towards certainty. And we can't do that if we are pushy salesmen, or fear-based and coercing someone. Next up, we don't want to forget that there are different entry points into your practice. Sometimes potential new patients just need to feel the warmth before they choose to become an official new patient. I'll explain that in a little bit when we discuss the objectives for each of the pathways. Pathway number 3. This one is interesting. This is what they value. They don't know they can value anything else. So we kind of talked about it briefly, but they value their insurance. How does it make you feel that the only reason that someone would come see you is because you take their insurance? So this for us is pathway 3, the insurance, the in-network insurance pathway. Since you are in-network, then they indirectly value you. Many offices are out of network though, and patients happily pay their out-of-network costs simply because the office understood the patient's primary and secondary concerns, laid out the expectations in a clear and transparent way, which the rest of healthcare currently lacks, guiding the patient to making a choice and supporting them along the way. Ask the value-based questions such as, if we can help you overcome this neck pain, for example, what would that do for your life? What value would that bring to your life? What would that mean for your life if you could pick up your daughter? And again, we always use social proof. We have helped hundreds of people just like you, Mrs. Smith, with low back pain, and we are confident we can help you achieve the same or close results. So here we go. The key objectives for the first call. The dream goal is that everyone calls the office and you handle the inbound call so well that there's 100% arrival rate or conversion from the call into a new patient eval. However, this isn't this doesn't always happen. It doesn't always work that way. So some fair outcomes to occur from our side of things is if someone enters pathway 1, and they come, remember, through that referral from a friend or a family or an MD, I don't recommend you try to set up a discovery. Skip the discovery appointment altogether. Do not offer a discount. And what I think you should do is you should book the high value new patient evaluation and then plug them into your system as a new patient. Welcome them to the practice, send them the welcome email, send them, if you have some type of welcome kit or some type of mailing that you send them, put that in the mail right away. I wouldn't even mention that you offer a discovery. It might be on your website, it might be on your normal sales script or your norm, but don't bother with the discovery. They've already been sold on what you can do for them, so there's no need for them to learn more about you. They just want to jump right in. Pathway number 2, I do think that it's a fair outcome for them to book a discovery, because remember, you want to take them from uncertainty to certainty. So booking a discovery is a great place to start, where then they come in. There's no obligation. Our discovery visits are free, where you and your staff provide a wow experience, and then they want to ask you to take them on as a patient. So this is where you have to put a lot of work into what your discovery visit looks like, what your in-person experience, customer service experience looks like. I hope you practice and you've rehearsed what it looks like when someone enters your world. And then pathway number 3, this is where it actually it's all in the delivery. And also, I mentioned earlier, it meant the important part of this is social intelligence. So if I'm talking to someone and they still are adamant about the price, or they're concerned they want to talk to a spouse, I will pitch them on the discovery. If someone is really apprehensive, if someone is really still in the information gathering phase, then I'll send them more information. If you're not ready to commit to a discovery, which means you're certainly not interested, or well, maybe not interested, you're certainly not ready to commit to booking a new patient eval, then I will send you more information. And so, like I said, if they're hesitant to get started right away, then offering them the information that they're looking for establishes credibility with them. And this could be in the form of a free book. It could be in the form of online videos like your YouTube channel, or maybe a closed Vimeo account that you only send out to patients. That there's a little exclusivity there that they might treasure and might value. It could be free reports. It could be checklists. It could be something of this nature. Something that's free that you're just giving them. It could be access to their blog. Like I said, it's just information. They're in the information gathering phase, so you want to have a voice while they're in the information gathering phase. And like I said, it's a great way to build trust and establish yourself as an authority in the longer term. Always ask permission to follow up them in a specific time frame to check in on them, because people really do like to know that you care about them personally. So as I mentioned, pathway 3, yes, it's ideal to answer all those those key questions about insurance and time and cost and And availability, absolutely. And we would love to have them be a new patient. However, if they're not ready to commit for that, then use a little social intelligence and offer them a discovery appointment. If they're still not ready to commit, then offer to send them information, in which case then they would enter into your CRM or your just your mailing system, however you follow up with your past patients and your potential patients as well. And this is all in the name of getting them to make their first commitment. I'm sorry, their second commitment. Their first commitment was the act of calling. And so calling today was their first commitment because most people don't actually take action on their health. So if someone's going to call, that's a pretty big step. It's a pretty big act of commitment to achieve their desired result. So the second act would be to commit, would be if they were to commit to, again, either a new patient evaluation or a discovery. And so the whole point of the call is to get them to take that next step and to have a second commitment. Again, last thing, it bears repeating, the second act of commitment was helping them make a decision on the phone with your guidance. And so after that, the very next thing is the third act, which is the follow through. So how do they follow through on their commitment to act? We called them to act. How do we then get them to act? And so this is the next tutorial that I'll put together, which is how do we achieve a 95% arrival rate in our office. And again, it has everything to do with how the phone call took place. Did you establish value in the outcome that you are going to deliver on, or did you establish value in insurance or your low cost price or in your location or in the treatments that you, or chiropractic care? Did you establish value in physical therapy, or did you instill value in the outcomes that your office or this office delivers? That's all for today. Thank you so much for sticking around. I know it was lengthy and I know I shared a lot of stories, but as I mentioned, next couple of tutorials will be coming down in the next couple of weeks, and I hope you enjoyed today. Thank you so much.